When shall I start?
It takes a lot of courage to push through hard times. Well, the entire world is facing a tough situation, and all we have with us is a hope for a better tomorrow. Good evening and a warm salute to you all. On behalf of Delhi Public School Dhenkanal, I cordially welcome everyone to yet another, the most awaited session of Sanjveen 2021. I am Shweta Dalmia, and I shall be anchoring today's session on health awareness, for which we have amongst us renowned Dr. Binod Kumar Mishra and Dr. Sukanya Mishra. Sanjveen 2021 is an e-fest, an innovation and a step ahead from the previous year's live sessions. The optimism of the management and the fraternity of the DPS Dhenkanal is a testimony to an age-old saying, when the going gets tough, the tough gets going. And here we are against all odds amidst this pandemic to entice, entertain, and enlighten all the lovely people watching us out there. At this point, I would like to welcome the Premier PVC DPS Dhenkanal, Shri Binod Das, the leading light Director DPS Dhenkanal, Dr. Lagnajit Das, revered Principal DPS Dhenkanal, Shri Vijay Kumar Sahu, valuable stakeholders, the parents, the lovely students, the entire team of DPS, and of course, our guests for today evening for their imperative presence. The unshaken endeavors and the zeal to excel of each one has made us what we are today. Mahatma Gandhi once said, health is the real wealth and not pieces of gold and silver. There is no denying that healthy living can be the greatest investment one can make. The COVID-19 pandemic has led to a dramatic loss of human life worldwide and presents an unprecedented challenge to public health, food systems, and the world of work. The ongoing pandemic has raised several alarms and hence the necessity for health awareness, which is a step towards building back better. We need long-term sustainable strategies to address the challenges facing health conditions of millions affected and millions at risk. So without much ado, I take proud privilege in introducing Honorable Dr. Binod Kumar Mishra, MD Pediatrics, retired Special Secretary of Family Welfare, Government of Odisha. He has around 32 years of experience, and with his motto of serving the humanity, he is presently heading the Department of Pediatrics at Capital Hospital, Bhubaneswar. And he is also a visiting consultant in KIMS Hospital, Bhubaneswar. Warm welcome, sir. We anticipate a lot of insights into COVID care for children, its prevention and management from you. I also request our esteemed Director, Dr. Lagnajit Das, to address Dr. Mishra before we move ahead with the session. Sir, please.
So, Namaskar, Dr. Mishra, welcome to DPS Dhenkanal's East and Fest. I thank you very much for giving your consent for this program. I am pretty sure that everybody, all our parents, all our students who are watching this, there's a big scare among everyone that children are going to be affected or children are going to be impacted. So we can take some healthy tips from Dr. Mishra. And I request everyone to join and be there in this program and take maximum benefit out of it. Thank you. Thank you, sir.
Good afternoon, everybody. Dear students, boys and girls, we are now passing through a critical phase in human history, as this pandemic, COVID-19, has forced us to change our lifestyle to prevent a big risk to human race. In this universe, there are millions of galaxies, and each galaxy is having billions of stars and solar systems. One of the solar system, our sun, and the family, Earth belongs to one of them. The planet Earth, so far as our knowledge goes, is the only living planet containing living organisms. There are animals, there are plants, there are bacteria, there are viruses, fungi. All are living for the last millions of years in harmony, obeying the natural law of selection. How to share my screen? Hello.
Yes, sir. You wish to share your screen, right? Just a minute, sir. We'll help you out. So you're the host now, and you will be able to share the screen. Please.
Sorry for the interruption. So out of these all living organisms, many are beneficial to us, and many of the bacteria, fungi, etc., and the viruses are also harmful to us. And this planet Earth contains all those living organisms. And I am showing this pandemic is caused by COVID-19 virus, and the structure of this coronavirus I have shown. It has 4 types of proteins. One is spike protein, other is envelope protein, another is membrane protein, and the nucleocapsid or RNA viral genome. This SARS-CoV or COVID-19 virus has spread all over the world, resulting in so much death and suffering and forcing us to change our lifestyle. This pandemic is not a new one. There are so many epidemics have already occurred on this earth, and in the past we have faced SARS-CoV, MERS-CoV, Nipah virus, Zika, and Ebola epidemics, which are deadly viral epidemics. Recent one is SARS-CoV-2. And it is peculiar in the sense that it is highly infectious and transmissible. It belongs to the family coronavirus because it has spikes on its surface resembling a crown. That's why it is called coronavirus. And I have already the structure of the coronavirus I have already shown, and how it spreads, that is most important, and most important thing to how to avoid or to prevent contamination to healthy individuals. The virus spreads from infected person to healthy persons by droplets. This RN virus, in comparison to other viruses, is a heavy virus. When an infected person coughs or sneezes, thousands and lakhs of viruses emerge out of the mouth or nose. But because it is heavy, it cannot travel a greater distance, and it falls with droplets within 6 feet. And that's why we should know that to avoid the infection to come to healthy persons, the social distancing is a prerequisite. Suppose the infected person coughs or sneezes, the droplets carrying the virus enters to the healthy person through its nasal mucosa, oral mucosa, or the mucosa of the eye. And once the virus enters the mucosa of the healthy individual, the spikes, they attach themselves to the ACE2 inhibitors, ACE2 receptors. And this spike-like proteins, they come in contact with the ACE2 receptors. Through this, they enter the cell. The virus are an enigma. They are neither living nor non-living. They cannot replicate out of their own. They have to take the help of some living cells, even bacteria or animal cell or human cell. So once it enters the host cell, it captures the nucleus. That means it captures the nucleus and directs the nucleus to synthesize the viral proteins instead of the proteins required by the host. So these proteins, which I have already told, the spike protein, the envelope protein, the membrane protein, the nucleocapsids, all these proteins are synthesized by the host cell, and they come together to form virus particles. And these virus particles, they injure the cell and cause inflammation, and ultimately it also destroys the cells. And the body recognizes the virus and now starts producing antibodies against them. If the body becomes successful in producing antibodies before the virus becomes critical or risky to the human life, then the person gets cured, the virus is eliminated from the body, and the person gets immunity. This I have already shown in this picture, how the virus enters the cell, how it directs the host nucleus to produce the virion particles. So how to prevent such a serious infection to infect the healthy individuals? That is the most important, and everybody should understand that how we can prevent it. So this is possible. The antibody production is possible by two means. That means the body produces antibodies by viral infection. The person gets infection and the body produces antibodies. But it's a lengthy process, and also it may harm the person may suffer or may die. The other way of preventing this is vaccination. In the vaccination, the whole virus, the living virus doesn't enter into the body. The particular protein which is responsible for initiating antibody production, that is introduced into the body, and the body recognizes the protein and produces antibodies against the protein, which ultimately prevents entry of the virus into the body. But the most important thing we should not forget is that the virus is very witty. That means every few days, almost we are seeing that it is changing its antigenic nature. So even if one gets infection by a particular virus with particular antigenic nature, few days after, the virus antigenic nature changes to a new virus almost. So the antibody produced from the past virus infection may not protect any virus infection which comes later because of the changing antigenic nature of the virus. That's why how to prevent it, that becomes definitely a serious question. Usually, these ACE2 receptors are present mostly in the pneumocytes of the lungs. That's why most of the times it causes a serious pneumonia, affecting the pneumocytes of the alveolar cells in the lungs. But there are other sites where these ACE2 receptors are also there. They are liver, kidney, brain, GI tracts. The antibody production capacity of the body usually diminishes with age. In children, their immune system is very strong, and that's why they do not suffer from serious disease. And if at all they suffer or infected, it gets cured with with no symptoms or few symptoms. And very rarely they become serious. So how to prevent infection from infected individuals to healthy individuals? That is the main question of the hour. I have already explained how vaccine may help to some extent, but in the future, whether it will be effective or not, nobody knows. So the most important thing for prevention of the infection is other methods other than the antibiotics or viral antibiotics. Most of them is how to prevent the contamination chain, transmission chain. If we break, then the infection cannot come to the healthy individuals. So social distancing, I have already told, if you maintain distance more than 6 feet, then even if the person is infected, he cannot transmit the infection of the virus to the healthy individual. So social distancing is very important. And number two, even if the infected individuals sneezes or coughs and the virus comes to the different surfaces, and we hold those surfaces, and from our hands it comes to our face, nose, mouth, and eyes, and through that mucosa the virus can enter. That's why we should use hand washing. Hand washing is the most important. So if you wash hands frequently, then the viruses remaining on the different surfaces, there are suppose the table, chair, many paper, the door bolts, etc. If we wash our hands frequently, then these viruses cannot enter into your mucosal cells. So hand washing is another important thing by which we can prevent it. Then Third thing is mask. If we use mask, then suppose I am infected with a coronavirus. If I use a mask, then that droplets will not enter into the atmosphere, into the environment, and others will not be infected. Other way around, if I wear a mask and other persons were infected, they stand nearby, even if they sneeze or cough, still the virus cannot enter into me. So in either way, in the two-way safety is by using face mask. So these are the three main stay of prevention of coronavirus infection. Number one is social distancing. Number two is hand sanitation. And number three is using face mask. And last but not the least is vaccination. I have already told. This vaccination has been introduced in our country, and 2 companies are producing corona vaccines, but it has not yet been introduced for children. It is now being given in the age group of above 18. But in the near future, this vaccination may also be given to children to protect them from the infection. But vaccination is not 100% safe or 100% effective, because in the near future some mutant strains may come and the vaccination may be ineffective, and new vaccines have to be produced. So the most important thing is to break the transmission chain. This breaking the transmission chain is possible by hand washing, or by hand washing by 2 things, either by alcohol containing sanitizers or soap and water. Soap and water is best. Alcohol containing sanitizers are also very effective, but it is not always available, and it is not available for everybody. So washing our hands, I have shown how to wash your hands. Washing hand should be minimum for 20 seconds with the soap and water. And these are the steps how to wash your hands. First, wet your hands, then take some liquid soap. Then there are 6 steps by which you can wash your hand so that no part of our hand is spared. So even if the virus droplets have come in contact with our hands, they will be washed away. The virus contains a lipid layer on the surface. This soap dissolves the lipid layer, and thereby the virus gets destroyed. And that is very important to prevent this transmission, because the virus will be killed by the soap and water and hand washing for 20 seconds. And masks are of different sizes, different types, but most important and safe and effective is N95 mask. Others are 3-layer surgical masks, and to be doubly sure that transmission will not occur, or the transmission chain can be broken, double mask can also be given, a cotton mask and a surgical mask. But to know which patients have been corona infected, COVID infected, we should know the symptoms. then only we can take precaution. Other than these procedures of preventing the transmission, we can also take other medications, etc., for the management of COVID patients. And there are 4 types of clinical presentation of this corona virus infection. One is asymptomatic. Here, asymptomatic, may be mild, may be moderate, and severe. These are the manifestations of the COVID infection. Asymptomatic patients, asymptomatic persons, not patients, they do not exhibit any symptoms. Usually, the suspect contact. Suppose a person has come in contact with a person who has some COVID-like symptoms. He may not, he may be RT negative, rapid antigen test negative, or he may be RT-PCR negative. Still, he will belong to this category of asymptomatic COVID patients. And suppose incidentally we perform RT-PCR test in a person, and the person comes out to be RT-PCR positive, but having no symptoms, then this is in the category of asymptomatic. Another test is there also to know whether the person is suffering from COVID-19 or not, is 6 minutes walk test. That is possible only for more than 12 years age group. And these patients, asymptomatic patients, asymptomatic persons, they should stay at home, maintain all the procedures which I have already told, that is using a mask, hand sanitization, isolation, no medication is required at all, and they should take nutritious diet, plenty of fluids. And but in mild COVID patients, usually the person having COVID infection, they will have sneeze, having rhinorrhea, having sore throat, etc. And we may suspect that the person might have contacted the infection. And in that case also, we should isolate the patient, and the patient should take paracetamol or throat soothers like this, and no antibiotics are required for these patients. But in moderate cases, in mild cases, the oxygen saturation is usually more than 94%. But if the oxygen saturation falls with all the symptoms I have described, if the oxygen saturation is between 90 to 93, that after less than 94, then this is a moderate risk COVID-19 patient, and we should keep the patient in the dedicated corona healthcare centers, because at any moment the oxygen level may fall and the patient may become serious. Those patients should be kept there and given paracetamol. And here also antibiotics are not required, because virus does not respond to antibacterials. But if the patient is having some other bacterial infection or getting treatment for some other infection, then they can continue antibiotic, but otherwise only for COVID virus infection, it is not required. But if the oxygen saturation falls below 90, the patient is breathless and having other serious features like shock, like coagulative disorders, heart failure, etc., then the patients should be sent to COVID hospitals in the HDU or ICU, where they can be given super specialty care, and if required, even ventilation can be given if the oxygen level cannot be maintained by oxygen. So these are the different clinical features of different grades of severity of COVID infection. Therefore, we know that it is a serious infection. Usually, children do not suffer from severe COVID infection. Still, some of the children, they may also suffer. So how to keep these children in the isolation in the category of mild or moderate? In the mild and asymptomatic cases, that is also very important, because children usually do not obey the rules and regulations, the restrictions imposed by the doctors or parents. So small children, the infants, they cannot be kept in isolation without mother. So in those cases, mother and child is taken as a unit. The baby or child should not be separated from mother. They should remain as a unit, and the child or the elder, suppose the child is around 5 to 6 years or 8 years or 10 years, in those cases, they can be kept in isolation, but they should not feel lonely. Social contact should be maintained, and they should be allowed to interact over phone or video calling, like that, so that they will not feel isolated and they will cooperate with the treatment. And isolation is very important, we know, and unless we isolate them, they may get infection or they may give infection to others. Next. So, in the prevention of COVID infection, we have already know that there are few things which we must not forget. That is maintaining social distance, hand sanitation by either by alcohol containing sanitizers and or soap and water. Number 3 is using mask, and whenever vaccination is available for children, they should avail it. They should hesitate to take it. Many children may be afraid of taking a prick, but whenever it is allowed for the children, they should all take the vaccine, and in the near future, they may also be allowed to take this vaccine. So all these measures are very important. These health measures are very important for the safety and precious life of the children. And therefore, these things they should not remember. And 3 things one should never forget is wash your hand, wash your hand, and wash your hand. Thank you.
Thank you so much, sir, for that valuable insight and comprehensive explanation about this deadly disease. I'm sure a lot of questions have already been answered. But before we proceed with the questions which my young learners have with them, I request your admin to make BPS admin the host now. I think that is done. That is done, sir. Thank you. Thank you so much, sir. So we have some young learners with us who have some concerns apart from whatever you have shared with us, sir. So
yes,
they are waiting for them to be addressed. Allow me to just solve those queries, sir.
Okay.
To start with, we have Akshat. Akshat, please unmute yourself and ask your question to sir.
Yes, ma'am. Good evening, sir. Good evening, everyone. I'm Akshat Padhi of grade 10 DPS Dhekana. So, sir, why do infants cry so, sir, and why so often?
Now, this is related to this during this COVID infection or at any other time? What do you mean?
No, sir, it's other. from
during
that.
this COVID epidemic, COVID pandemic?
No, sir.
I think
Okay.
that's a general
Oh.
question, sir. Yes.
Oh, okay.
Yes.
General question. Anyway, you see the infants are small adults. They have many other requirement, many of the needs, but they cannot express themselves. So that is only strength is crying. Whenever they suppose are thirsty, they feel hungry, or they are having some pain somewhere, or headache, body ache, fever, the sense of vomiting. Whenever they feel like that, they cannot express. They cannot say that I am having these symptoms. So they just cry to attract the attention of other people. They attract the attention of the parents, so that they will address to their grants. And particularly if that question is extrapolated to COVID-19 situation, suppose an infant has been infected with COVID. He may have symptoms, he may have fever, he may have a sore throat, he may have headache, he may have myalgia. So the child will cry. The child cannot say that I am having headache, I am having pain in the throat. So we have to, we pediatricians, we know, we never ask the patient about their symptoms. From the presentation, how they present, from that we try to know what is their problem by our experience.
Thank you so much, sir, for helping me to understand.
Thank you, sir. The next in line, we have Sumapika, sir, who has another question. That's a serious concern, I believe. Let's see what Sumapika has to ask. Please unmute yourself, Sumapika.
Good evening, sir.
Good evening.
Of Standard 10 at DPS Dinkanal, and thank you, ma'am, for giving me a chance to speak. So my question to you, sir, is that how to deal with issues like segregation, boredom, and mental stress a child may suffer if detected COVID positive.
Yes, that's a very good question. Because during COVID-19 infection, if a child gets infected, then the child has to be isolated. And usually, I have already told, the child and mother-child is a unit. You cannot separate one from the other. If the child is separated from the mother, either the mother is happy, nor the child is happy. And the child will protest in various ways because of the mental stress. So to avoid that stress, I have already told, one is the small babies should always be with mother. Number two, bigger children, they should be allowed to kept in isolation where there are facilities for playing something, or they should usually be allowed to interact with the other family members by phone or by video calling, so that they will not have stress during this time, and they will be happy to see their family members, and they will not feel isolated. That in that way, we can avoid stress in the children.
Thank you so much, sir.
Thank you, sir. So the third question is coming from Soumya Pradhan, but I think you've already addressed that. But still, if she is not very satisfied with your explanation, we will allow her to ask this question. Soumya, please unmute yourself and ask your question.
Thank you, ma'am. A very good evening to everyone and respected
Yes,
sir. I am Soumya Pradhan of class 10B DPS Dinkanal. It's an extreme privilege to be over here and get an opportunity to ask questions. So, sir, my question is that how far are antibiotics actually effective in treating COVID-19?
You see, antibiotics are chemical agents which are against bacteria, but virus is not a bacteria. Virus, I have already told, virus is neither living nor non-living thing. It cannot multiply itself. All living organisms have a property that they can replicate, but virus cannot replicate. So it is an enigma. You cannot say it a living thing, or you cannot say it is a non-living thing, because it utilizes the cell nucleus. It is, rather than you can say it sabotages the host cell nucleus to produce the viral proteins which gather together to form a virus particle. So antibiotics have no role in COVID-19. Of course, after COVID-19 pneumonia, suppose some secondary bacterial infections occur, then only antibiotics has a role. Otherwise, only for COVID-19 virus, and antibiotics have no role.
Thank you so much, sir, for your answer.
Thank you.
Yes, thank you again, sir. I think there is one last question which is coming up from Divyanshi Kedia, a young learner from DPS. Divyanshi, please post a question. Unmute and ask.
Good evening, sir, and good evening, everyone.
Good
I am
evening.
of Standard 8A, DPS Dhenkanal. Thank you, ma'am, for allowing me to ask question. Sir, my question is, due to this pandemic situation, we have started our online classes. We are doing our online classes on our laptops, computers, and phones. So, how can we prevent our eyes, protect our eyes from being affected by this?
Yes, that's a very good question. And nowadays it has been a usual practice that all the children, they learn through their online classes. And they stare at the mobiles or the laptops for a prolonged period. By this, a lot of stress is exerted over the eyes. So to prevent that, the classes should not be lengthy one. They should not stare at the screen for prolonged periods. At intervals, they should take rest. Number one. Number two, the accommodation property of our eyes is dependent upon other nutritious food and vitamins, particularly vitamin A. So the children should take plenty of nutritious foods, plenty of water, and foods which contain carotenoids. That means precursor of vitamin A. That is, those things are available in most of the yellow vegetables and fruits, carrots, mangoes, pumpkins, and green leafy vegetables like palak or other green vegetables. They should take in plenty of quantity so that their vitamin A level in the body will be high and their vision will not be affected and the stress will be less. And in this way, this during this pandemic season, when the children are forced to learn through laptops, mobiles, online, they can protect their eyesight.
Thank you, sir, for your
Thanks.
Thank you, sir. If you may allow me as a parent, even I have a few concerns. If you please allow me,
No, yes, you can
to
ask.
them. Sir, there is a lot of hue and cry about boosting immunity. So many fruits like orange prices have suddenly increased, and all the fruits which contain vitamin C are not easily available in the market, if I can say. Vitamin C tablets or zinc tablets are available in plenty. And everyone is talking about various tulsi drops and this, that. So how far is it true that if we consume these things, our immunity would be boosted overnight and we would be able to prevent or protect ourselves against corona?
Yes, that is a very good question. In my opinion, nature is the best doctor. All the antioxidants are available in our surroundings, in our food. And if we take plenty of these fruits already I have mentioned, and they should be fresh, they should be without insecticides, they should be from a natural source. And if these foods are taken in our food, then there is no such necessity of taking extra vitamin C, vitamin A, etc. Because in this time, during this time, and we are accustomed to a particular life, and we are not taking balanced diet or nutritious diet. That's why sometimes we may require some supplementation. And moreover, the supplemented nutrients, it should be come from a proven source. So many people are claiming that this is a very good tonic. This will boost your immunity, but there is no proof. But few things are actually boosting our immunity. Those are, I have already told, is vitamin C, zinc, vitamin A, and all other vitamins. They actually help to boost our immunity. But the claim of all cannot be taken without any doubt. So that should be proven. It should be proven and certified immune boosters. Then only we can take it. Otherwise, the claim of everybody should not be taken for granted.
That was satisfying indeed, sir. Thank you so much. Thank you once
Thank
again,
you.
sir, for simplifying all the concerns which we had so far related to Corona and this pandemic. And I'm sure this is going to go a long way to help all the people watching us live there, to all the students who posted their question. I'm sure it is going to be of tremendous benefit to all of us. Thank you once again, sir.
Thank you.
I would just like to request Dr. Das, Dr. Lagnajit Das, if you have, sir, if you have anything to address, or our honorable principal, he's also with us, Shri Vijay Kumar Sahu. Sir, if you have anything to ask or anything to address to sir, please.
It was a very wonderful session, very well addressed. I think all the concerns would have been, all the queries would have been cleared. Staying in difficult times, but we have to move on with the daily lives. And it has been difficult time for the past 2 years, 1.5 years almost. The children are not coming out of school. So physical health and mental health wise, we should take care of our kids, our children at home. That's all. Thank you. So please continue.
Thank you. Thank you so much, sir. Let us now move on to the other part of the session and gather some beneficial tips on oral care and hygiene. To enlighten us with oral care, we have amongst us graceful and multi-talented Dr. Sukanya Mishra. Ma'am is a young graduate from Institute of Dental Sciences and is currently pursuing her 3rd year in implantology from the same institute. Dentist by profession, she is good listener, which helps her to understand her patients, friends, and family better. She is also a Pattachitra artist and believes in teaching the same to the young learners. I think it's her capability of effective time management which enables her to juggle her passion and profession judiciously. I'm sure ma'am too has worthy tips and tricks to share with us. Lagnajit sir, I request you to welcome ma'am once again so that we can move ahead with our session.
Good evening, Dr. Sukanya Mishra. I welcome you to this seminar. Thank you so much for sparing your time. Please go ahead and give tips to our students on how to take good care of the dental hygiene. Thank you so much. Thank you so much.
Good evening. Yeah, thank you. Okay, so Shweta ma'am, would you please just make me the host so that I can start my screen share and
Sure,
start
ma'am.
my screen. Yeah. So is my voice clear and loud enough?
Absolutely, absolutely. Ma'am,
All
you're
right.
the host now.
Yeah. Okay, thank you. All right. So I guess many children were already waiting for this. So when I was live also, I think one of my niece also sent me her photograph that, yeah, I'm holding my toothbrush and paste to just listen you live over here. So anyways, we should start with our talk of today, that is steps and stairs for oral hygiene, specifically in this pandemic time. Okay. So the first questions that we always ask to someone, or that we always neglect also, is what is oral hygiene? First thing that we need to know is what is oral hygiene. So oral hygiene is specifically a practice of keeping the oral health, or you can say a practice of keeping the mouth free of diseases. Okay, so how this practice will be by regular brushing and tongue cleaning. So this everyone knows. Yeah, this is a very normal thing that everyone knows. So the next question is, what are the steps for oral hygiene? What do we need to do to have a proper oral hygiene? What are the steps that we need to follow? First step is toothbrushing. Yes, we need to brush our teeth twice daily. Why twice? I'll say you later on. Okay. And the second step is tongue cleaning. Okay, so we need to also keep our tongue clean. Only keeping the tooth clean or the teeth clean will not be enough. Okay, and the third thing is flossing. So this is the most neglected part that we always forget, is we need to floss also. And if we don't do all these three steps, or we do not follow, if we do not follow these steps, then what will happen? We will be landing up with decayed tooth or bad breath, that is halitosis, also known as halitosis. And the third thing is bleeding gums. Apart from these, there are several kinds of diseases or the oral diseases that may happen. You can say ulceration, that is also one of them. All right, and so the next question that comes is, are we brushing the right way? All right, so most of the people, even I was, when I was young, what I used to do is I was just keeping my tooth positioned over the teeth, and like, sorry, brushed position over the teeth, and I used to just rub it and ho gaya mama. I'm full with my, like, I'm done with my toothbrushing. But that's not the exact way of toothbrushing. So this video will help you out. So we need to brush our teeth in the morning as well as at night. Okay, what we need to do is that we need to keep a brush. Okay, so also we need to keep we need to brush our teeth for 2 minutes, not more than that, not less than that. If we brush more than 2 minutes, then our tooth will start upgrading, it will wear off. Okay, so we will take a pea-sized toothpaste over the toothbrush, like medium bristle toothbrush, and then we will keep it angulated with the tooth, angulated as in inclined with the 45-degree angulation. Okay, and then we will move the brush in a circular direction. All right, after this we will do in all the surfaces of the teeth. Okay, we will move the brush in circular direction in all the surfaces of the teeth, and then we will move on to the occluding surfaces. What are occluding surfaces? These are biting surfaces. Okay, we need to also keep our biting surfaces clean. So after that, we will have a, like, after the circular motion, we need to have a sweeping action towards the downwards. Okay, to the downwards, in the downward direction, we will be having a sweeping action. So the accumulated debris over the teeth, what will happen is that it will, when we have a sweeping action, it will just remove it. Okay, then the next thing is, so this will prevent the plaque accumulation. Okay, plaque accumulation is the tartar or the plaque that we have, that is the debris on the tooth surfaces, will be prevented if we follow the right steps of brushing. Okay, then the next step is flossing. So the question is, what is flossing? What we usually do, we only brush our teeth, we only brush our tongue, but we do not do flossing. What flossing does is that after cleaning the tooth surfaces, the debris get also accumulated in the interproximal surfaces, that is in between the tooth. So what happens if we do the flossing in a proper manner, then the debris that are already accumulated between the teeth, it will just come out. So how do we do that? How do we floss our teeth? So there are very easily, they are available. The floss is already, like, dental floss is already available in the market. So what we need to do is we need to spool it over our fingers. Okay, we need to make a round over our fingers, just like we do for a thread, and then we just insert it in between the teeth. Okay, and then just take it out. Was insert it, take it out, insert it, take it out. Do not try to injure the gums. Okay, you are not supposed to cut the gums. So this is how flossing is done. So what types of toothpaste to use? So this is a very common question everyone asks, कि कौन सा toothpaste use करना है? What toothpaste are we supposed to use? So we are supposed to use fluoridated toothpaste. Okay. So how do we know if the toothpaste is fluoridated or not? So just like over the medicine strips, similarly on the toothpaste like tube, you will see there is a composition written over there. So if it contains fluoride, just check if it has stannous fluoride or sodium fluoride or something, a combination of the like elements. If it is present, that means it is a fluoridated toothpaste. So why fluoridated toothpaste is required? Because it will help in remineralization of the tooth enamel. Enamel is the protective layer of the tooth. Okay, so it will help in the remineralization of the enamel because enamel requires fluoride for its formation. Okay, and it will also exert an antibacterial, like it has antibacterial properties, and these two properties will help in prevention of further decaying of the tooth. Okay, so this is why like fluoridated toothpastes are required. So what kind of fluoridated toothpastes are available in the market? The question is what kind of fluoridated toothpastes are available? So we have Colgate, we have Pepsodent, we have Close-Up, okay, Sensodyne we have. So what people do, they use Sensodyne as a normal regular toothpaste. No, it is not a like it is a medicated toothpaste. It is not a regular toothpaste. Only if you are having sensitivity, then only we are supposed to go for Sensodyne. Okay, so these three toothpastes can be used if it has, since it has a fluoride composition in it, but I will recommend that do not go for any toothpaste that does not have fluoride content in it because it will lead to tooth decay. All right. So are these steps only necessary for to have a good oral hygiene? No. At the end, we also need to have a mouthwash. Okay, we need to gargle our mouth with a mouthwash. So what kind of mouthwashes are already available in the market? It can be Listerine, it can be Colgate Plaques. So why mouthwashing is required? What we do, see, basically when we take bath and we apply soap, we are supposed to use we are supposed to use water to remove the soap surface, like the surfaces that are formed over the skin. But in case of tooth also, if you're brushing, if you're cleaning our tongue, mouthwashes are required to clean the tooth surfaces out of, like it needs to clean out the debris. So you will ask me that normal water can also help. No. See, mouthwashes are having antibacterial properties. What happens is that when you use mouthwash, since it has an antibacterial property, it does not let the accumulation of microorganisms on the tooth surfaces. And the accumulation, prevention of accumulation ranges from 6 hours to 12 hours. So our tooth surfaces or the oral cavity stays protected from any microbial attack by using mouthwashes. So mouthwashes are very important after, even after if you're brushing or if you're doing a tongue cleaning. All right. So what kind of food we need to prevent to that may cause damage of tooth? Okay. So we need to prevent. So every one of us knows sweet things are supposed to be prevented. See, not all sweet things are bad. We are mainly supposed to avoid, we are not supposed to stop, we are just supposed to avoid anything that contains carbohydrate in it because the bacteria loves carbohydrates. It's its nutrition. Okay, so what happens is that when you eat any carbohydrate food, it sticks on the tooth surfaces. Okay, and that will lead to fermentation, further fermentation of carbohydrates, and that will lead to tooth decay. Okay, acid environment is formed after fermentation of carbohydrates, and that leads to tooth decay. So basically, bacteria is not eating your tooth. Okay, the food debris that are accumulated, that are fermented by the bacteria, and that causes tooth decay. All right. So what are the food that we should eat? We should encourage eating for having a healthy tooth surface is hard vegetables or fruits. What happens is that they have a cleansing activity. When we eat fruits, it has a cleansing activity. Any rough-based diet or any fruits, all those have a cleansing activity. Secondly, the nuts and the proteins help in the formation of a fatty layer, or oily layer over the surface, and that does not, it forms a barrier. It forms a barrier between the carbohydrate fruit or the carbohydrate food, and it prevents the fermentation or the tooth decay. All right. So the next question comes on how COVID-19 is affecting oral health. See, basically COVID-19 is not affecting oral health. What we need to keep in mind is that the COVID-19 viruses, it enters through the mucosal surfaces. As Sir said in the earlier talk, he said that it enters through the mucosal surfaces or like the respiratory surfaces, like this the nose or the the nostrils, and then we have the oral cavity, and you also in some cases you can also say through the eyes also, because it is also mucosal surface. So we need to keep our oral health good to prevent the virus to enter to the respiratory system. So how do we do that? Again, mouth washing. What happens is that the mouthwash keeps the viral load low. So basically few studies, since it's only 2 years that this COVID-19 virus has caused this pandemic. So I would say that few studies have already said that chlorhexidine, that is, it is having an antibacterial or antimicrobial effect. So it can help in keeping our viral load in the mouth low. So whenever you're going out and we are coming back home, the main things that are said to you is that you should wash your hand, you should wash your legs, or you can also take bath. But also there's an important step that we should not forget is we are also supposed to keep our oral health good by doing mouthwash. So whenever you're going out, just come back home and do a mouth gargle. So this will also help in if there is any contamination or there is any spread of the virus, it might lead to low viral load after you do a mouthwash. All right. So the next question also I have heard from many people is black fungus, whether it is an oral hazard, whether it is a myth or a truth. So the question, one of my patients asked me that, ma'am, I'm having a black spot in my mouth. So I'm just scared. I'm afraid that I do not want it to be black fungus. Okay. So oral like black pigmentation does not mean that it is a black fungus. Black fungus happens only if we are having a low immunity, like in cases of diabetes, HIV, or those who are having low immunity from the childhood. So in those cases, we have seen cases where we may find black fungus or mucormycosis, but it is not an oral disease. Okay, it's very important to stop this rumor to spread that black fungus is not an oral disease. Okay. So the next thing, I will also share one of my patients' photograph. See, this is a case where he was having he was a chronic gutka chewer, okay, and he had COVID-19 disease. He was also admitted in the ICU, and he was having low immunity. So what happened is that after coming back, he saw that he is having having osteomyelitis. So it is fungus induced osteomyelitis. So why it happened? We need to keep in mind that we need to have a healthy diet. Okay, we are not supposed to have bad habits like gutka chewing, pan chewing, because it may trigger or it may deteriorate the health of the oral cavity. So this might be also a reason why this thing happened. Okay. COVID-19 is exactly not affecting oral cavity as such, but we can expect that if we keep our proper oral health, we might see the decrease in the viral load. All right. So this was all I wanted to say. Hope you guys understood properly. And the only thing that I would recommend is stay home and stay safe. Thank you very much.
Thank you so much, ma'am. That
Yeah.
was enlightening indeed. And I think we have discovered another side of this scary disease, coronavirus. And there is one more reason and one more way, rather, through which we can prevent this disease. Oral care and oral hygiene is a must. That is what I have understood. And I'm sure my audience and all the viewers must have understood the same. Ma'am, we again, as we did with Sir, we have a few questions by the students. So they are already eager to post them to you. So shall we start, ma'am?
Yeah, sure.
All right. Let us start with Devanshi. Devanshi, please unmute yourself and ask your question to ma'am.
Good evening, ma'am, and good evening, everyone. So is that what causes teeth to become yellow in color?
Okay. So what happens is that most of the patient, they come and say that, ma'am, my tooth has become yellow in color. See, the color of the tooth is already yellow. It is not white. Okay, the natural color of the tooth is already yellow in color. Why? Because the tooth is having 3 layers. Okay, the first layer is the enamel, the outermost layer, that is translucent. Okay, and the second layer is the dentine, which is yellow in color already. Okay, and the third layer is the pulp. So what happens is that since enamel is translucent, the dentine reflects itself as yellow in color, and that's why the tooth looks yellow. So other things that might, that's the intrinsic color of the tooth. Also, there might be some extrinsic factors that may lead to yellowing of the tooth, because as we see in our Indian food habits is already we put lots of haldi and it has a color of its own. So that might also lead to yellowing of the tooth. But as we can, the other question that you may ask, that how can we see the actors and actresses having white layers or white color of tooth? So basically what they do is that they put they use the laminates. Okay, they are white in color, which are usually some kind of crown that are given over the tooth to make it more appealing and more aesthetic. So yeah, that's how you can just make your mind set up that it is already yellow in color.
Thank you, ma'am.
Thank you.
We have Akshat once again, ma'am, to post his next question to you. Akshat,
Okay.
please unmute and ask.
Yes, ma'am. Good
Okay.
evening, ma'am.
Good evening.
Ma'am, I was having a question that what can we do to keep our teeth stronger and help them to be in a good shape for long?
Okay, so teeth can be stronger. Basically, the teeth is already strong. Okay, so what happens is that if you see that the tooth is mobile, it might be because the tooth and gum interface is weak. And why is it weak? Is that there is formation of debris, there is formation of plaque, there is formation of calculus, which hardens, and with time, gradually, the gum starts receding. Okay, and you see that the tooth has started it has become more mobile, and after some days you will see the tooth has already fallen. So what we need to do is that first we need to maintain the proper oral hygiene. This is how you keep the gum stronger. So if you ask me how to keep the tooth stronger, is healthy diet. As I said, you need to have good amount of vegetables, fruits that always keep your tooth clean, and you need to have proper milk for calcium, and you need to have a good oral hygiene. That's it. That's all is required.
Thank you
Thank you,
so
ma'am,
much,
for that
ma'am.
lovely explanation. I hope
Thank
your question is answered, Akshat.
Yes,
Okay,
ma'am.
ma'am. We have Soumya again, next coming up with a question. Soumya, please ask your question to ma'am.
Yes, ma'am. Good evening, ma'am.
Good evening.
Say that what are the dangers of oral piercing and how can we deal with these dangers?
See, first and foremost thing is oral piercing are always not recommended. Okay, but still, since the generation is such, so we can see that what are the dangers is that if we do oral piercing, the first and the foremost thing is infection. It may lead to swelling, it may lead to severe pain, it may also lead to abscess and septic of that area. So we need to avoid such things, but also there are some aesthetic appealing things like tooth piercing. You can go for that, but there is also, again, we need to drill the tooth and we are just uh, like uh, uh, putting the tooth in danger, you can say. Okay, so another thing that may happen is a spread of any disease. Okay, if they are not using a sterile syringe or sorry, sterile for piercing and all those things, if they are not using sterile instruments, then you may see that there have been cases where there has been transmission of hepatitis, HIV, and all those things. So it's better to avoid such trends. Yeah.
Thank you so much, ma'am.
Thank you.
Thank you, ma'am. We have another question coming up from Somapika. I think she has a very serious question. Let's see. Somapika, please unmute and speak.
Yes, ma'am. Good evening, sir.
Good
So my
evening.
question to you is that how can someone get rid of teeth grinding while asleep?
Teeth grinding. Okay, all right. So it's a very good question actually. See, teeth grinding can be of various reason. The first thing is if your occlusion is not right. If occlusion means when your bite is not right. Okay. Sometimes what happens that the people are having malaligned teeth. So if there is malaligned teeth, what happens is that there is already some wear off because of the malalignment or since the teeth are already in a wrong position. So we need to correct that first. And the second thing that is important is some people are having hyperactive muscles over here in the near the joints. So for them and also for the stressed people, like those who are very much stressed in occupation or in their life, they are also they may also have a involuntary bruxism, it is called the teeth grinding, or you can say it bruxism. So what happens is that there is a gradual wear off of tooth, and you may find that there is pain in the muscle, and also gradually you will see sensitivity of tooth. So what we can do is first we need to have a good alignment of the teeth. Second, we need to ask the person, what is your occupation and are you stressed enough? Do you feel pain when you get up early in the morning? Do you feel back pain? So we recommend that these people should go for yoga, meditation, and they should start living a healthy life first. Third thing we need to see is already those who are having a very severe cases, we can advise them like at night they are given appliances to wear so that when they're sleeping, the teeth grinding is avoided. So yeah, this is how, but then gradually it will stop. It stops, yeah.
Thank you so much, ma'am.
Thank you.
Thank you, ma'am. One last question from one of my students here, Rupali. Rupali, please unmute and ask your question.
Good evening, ma'am.
Good
I am
evening.
Rupali Patnaik of class 8A DPS Dhenkanal. And my question to you is why wisdom teeth cause so much pain when it comes out?
All right. So here is one fact that I will say. It's a very mysterious fact actually. So people are saying that with evolution, what's happening is our jaws are getting very short and our head are getting bigger because we are becoming more brainy, and we are having a like gradually we are starting to take fine food. Okay, we are not we are very much used to having fine food. Okay, so what happens is that there is a less requirement of teeth. The requirement of teeth gradually is decreased. So with evolution, what is happening, the teeth that is already the last teeth that erupts at the age of 18 to 25 years, what happens is it stops, it does not erupt, it has become vestigial nowadays. Okay, so we are also recommending people not to, if they are having pain, we are recommending that it's not an important tooth. If you want, you can just take it out. If you're having already 2 molars, the third molar is not that important. So the question that you asked is why is there so much pain? So already since the jaw is very short, what happens in maximum number of cases, we are seeing that the tooth is not getting place to erupt. It is pushing the other tooth. It is trying to come out, but it is not able to. So it is impacted. Okay, it becomes impacted, and that's why we find that there is anyways when normal teeth erupts, there we will see that it tries to impinge the gum and pierce the gum, and it comes out. So there is pain. Sometimes there is also fever because of the inflammation. But in case of impacted tooth, since it is not getting the right amount of space to erupt, there is severe pain. So we recommend either to wait for some time if the tooth erupts well and good, or else just remove the tooth. Yeah.
Thank you, ma'am.
Thank you.
Thank you so much, ma'am.
Thank you.
I think all the tips and all the information that you shared with us, and moreover, the answers which you gave to the questions which our students just now asked you, that has added a lot of information to whatever we knew. I think we knew very little about oral care and oral hygiene. And we think that we have definitely attained a lot today through this session. At this point, I request Lagnajit sir once again if he wishes to address ma'am and sir, post which we will deliver.
I'm a big foodie. So when the presentation was going on, I was just thinking, after seeing all those images of sugary foods, and also the advice was 2 times a day to brush your teeth. But I think I have to do it 3 or 4 times in a day to keep my oral hygiene. It was a wonderful presentation. Thank you, ma'am. Thank you so
Thank
much for spending your time.
Thank you.
Ma'am,
Thank you.
please.
Yes, indeed, that was a fabulous session, I must say. I have gulped down each and every piece of advice and information which our esteemed guests have shared with us today. And I'm sure our audience must have a lot to take away from today's session, because it is at this time that we need to focus on our health and protect ourselves against this pandemic. As I told earlier, we have to have strategies to build back better. And I'm sure we have already made a beginning. I extend my sincere, my heartfelt gratitude to Dr. Binod Kumar Mishra and Dr. Sukanya Mishra for sparing so much of time to us and guiding us through. We genuinely value your suggestions and advice. Your expertise and patience while answering the questions of the young learners is indeed commendable. I would also like to thank the Pro Vice Chairman, DPS Dhenkanal, Shri Binod Das, and Dr. Lagnajit Das for constantly guiding us to innovate. I extend my gratitude to Principal DPS Dhenkanal for his unfettered efforts to make Sanjiveen 2021 a grand success. This session would not have been possible without the enormous support of the audience, the parents, the people who joined us all through the live sessions, and of course, the lovely students. I thank each one of you. I convey my heartfelt thanks to the entire team of DPS, the admin team, the technical team, the housekeeping, and each one who has worked day in and day out to make this session a grand success. Thank you, everyone. Stay safe and keep healthy. Thank you once again, sir and ma'am.